Hello, thank you for attending today's therapeutic diet review presented by Anderson Nutrition Services. Today we'll be reviewing different therapeutic diets, looking at the diabetic diet, the heart healthy diet, the low salt diet, and the renal diet. In this webinar, we'll define all of these diets and compare them to a standard house diet. We will discuss which patients may benefit from each diet and how to implement these diets in your nursing or rehabilitation center. Starting first with the diabetic diet. To prevent blood sugar spikes, the diabetic diet looks to have consistent carbohydrate throughout the day. Swapping regular syrups, jams, and jellies with sugar-free syrups, jams, and jellies, replacing regular soda with diet or sugar-free sodas, swapping out regular juice for reduced sugar or 100% juice are some easy changes that can be made for patients with diabetes to help control their blood sugar. Additionally, limiting sugar or providing sugar-free sweeteners, substituting white bread with whole wheat bread, and offering reduced or sugar-free portions of sweets and desserts are easy ways to help diabetic patients control their blood sugar. The diabetic diet looks to provide low carbohydrate or low sugar options for these patients. For patients with heart disease and metabolic syndrome, a heart healthy diet might be a reasonable approach. The heart healthy diet is a cardiac diet, which includes a low fat and low cholesterol approach to nutrition. In this diet, we look to substitute full fat options for reduced fat or low fat substitutions. For instance, regular gravy can be substituted out with no gravy or a reduced or low fat portion. Solid fats, the ones that are solid at room temperature, like butter, cream cheese, lard, sour cream, and shortening, tend to have saturated fats in them, which is what keeps them solid at room temperature. In the heart healthy diet, we would substitute out those fats for fats that are not solid at room temperature, like olive oil, or soft trans fat-free margarine. In regards to fried foods, the heart healthy diet looks to minimize fried foods or to substitute with low fat substitutions. And milk, which is full of proteins, vitamins, and minerals, can reasonably be substituted for a fat-free version. Though patients with heart disease may also benefit from the low salt diet. The low salt diet benefits patients with heart disease, liver failure, chronic kidney disease, or edema. The low salt diet looks to remove added salt, especially processed salts, from the house diet. For example, processed meats like bacon, sausage, corned beef, ham, bologna, and roast beef are loaded with extra salts. Many of these salts are added in the processing of these meats, and so low sodium alternatives are available. Salted snacks like chips, popcorn, pretzels, and pork rinds. Salted snacks such as chips, popcorn, pretzels, pork rinds, and saltine crackers often have low salt substitutions as well. If low salt substitutions cannot be made, then no salted snacks should be provided under a low salt diet. Pickled vegetables and olives are full of added salts. Under the low salt diet, omit them or substitute them with a low salt vegetable of another kind. Added salts are especially problematic for patients with chronic kidney disease, and therefore these patients may also benefit from the renal diet. In the renal diet, we look to limit the amount of sodium, potassium. In the renal diet, we look to limit the amount of sodium, potassium, and phosphorus to help benefit patients with kidney disease. This can be done by substituting regular fruits and vegetables for ones that are not rich in potassium. This means excluding bananas, oranges, orange juice, prunes, and raisins from the standard selection of fruits. Vegetables high in potassium, like tomatoes, spinach. Vegetables high in potassium, like tomato and spinach, should also be substituted with a low potassium alternative. Tomato sauce and V8 juice also have a large amount of potassium and should be avoided under the renal diet. Additionally, regulating dairy and providing no more than 1 serving of milk per day to patients with kidney disease may help benefit them under the renal diet.